gotta get the stream started here. Sorry, people. Thank you for your patience. Really appreciate it.
We apologize for 10 minutes. For them to
Want to ask a clarifying question, mandate.
That's what I said, right? It wasn't 15, it was 15. It's that first one.
We can pull it up if we need.
Yeah, there's.
Okay.
All right, we good?
Yep.
All right.
Oh, here, you need to read.
It's under a pressure. You could manage to get it.
Yeah, let's make sure we have it rolling.
Yeah.
Did you mute it on that?
Here you go, Bryce. There's the link. Technology's great. It works, right? You got it?
Test it. Yeah.
Oh, we're gonna budget that? All right, we good? All right, welcome back. We've been in executive session for a little while. Thanks for hanging with us, for those of you that have waited online. So our first action item is the USD 417 2021-2022 operational guidelines. And that will revolve around how we want to handle some things as far as the pandemic and the COVID-19 things. But before we go down that path, the board would like to just make it clear that some of this is out of our hands at this point in time. I think there's some misconception out there that we have some choice in this matter. We appreciate the work that Dr. Freese and our county health department have done, that our county commissioners have done, and they've passed this mandate. And we feel that it's our job as a school board to follow that mandate as it's basically a law. We just feel like that's the appropriate thing to do. We are going to post that mandate to our Facebook page. There'll be links to that. It's also on the Morris County page, Morris County Health Department's page. It's in various places. The Republican, I believe, has published that. If somebody would like a copy of that mandate, please reach out to any of us. We're more than happy to provide that for you. There was some talk of whether or not we would read it here, and we've chosen not to do that. But we just want to make it very clear that this isn't something we're voting on tonight as to whether or not we follow the mandate. We're going to follow the mandate. And that's just what's going to happen. So with that, we do have some questions, and Dr. Freese and Candy are here and have been gracious enough to offer to answer those questions. So we have a handful of questions here that we'd like to ask.
Dr. Freese, I'm going to ask these and let me know if you need clarification. We came to these together. And so one of the questions that we had, because of course we're getting questions from our patrons as well, is can you tell us what would determine the matrix for ending the mandate in your mind, in your eyes, and moving forward?
Well, what would certainly help to in the mandate would be that we have improving numbers of various studies, cases, deaths, hospitalizations, children's hospitalizations. So all those things would be important. Another important part.
Can we please have Dr. Freese speak up just a little bit more?
That better, Adam?
So my idea behind when to end a mandate for masks is when the numbers improve. When we're not seeing such a sharp rise in illness cases, hospitalizations, ICU admissions, deaths that are like is occurring now. The main thing that got us into trouble this summer is the Delta variant, which is, you can almost think of it as a different virus. It acts differently. It is much more transmissible. And so that's one of the things that drives all this and why we need it. We need to get it stopped now. Vaccination would be a very good thing, but if you got everybody vaccinated today, it would probably be 2 months before you'd see any effect of that. It takes that long for the immunity to build up. So the only tools we have left, masking, social distancing, and some things about hygiene. And trying to keep people, students apart from each other. I certainly wish it hadn't come to this, but the Delta variant is what's driving this. It was something nobody really anticipated would happen, but it has.
Thank you.
Okay.
Our next question is two-part, and you touched on this a little bit.
Okay.
So is vaccination status related to ending the mandate, which I think you covered? You said we would still be several months out, even if
Yeah.
everyone got vaccinated tomorrow.
That's correct.
But one of the other things that we had a question about, you mentioned 49% as an immunization rate. Can you tell us, is this number or percentage vaccinated, or how this number was derived? And are these statistics just including Council Grove or the entire Morris County? And the final piece of that is, does this also include folks who have immunity through having had the virus?
Okay. And
And I can
Kendra,
repeat any of those. if you need to.
and Kendra can help me with that with the numbers, but the 49% number on vaccinations in the county is based upon total population. No, I'm sorry, I got that wrong. It's based on eligible population. Who can? It does not include under age 12 because they cannot be vaccinated yet. So it is, so 49% is the number of the percentage of people who are eligible, no, total population.
Eligible to be vaccinated,
Eligible,
so 12 and
yeah.
older.
And then the other 43%, which I believe now is 44%, are the people of the total population.
Total population.
So the lower number is total population. The higher number is just the people who are eligible, what percentages have become fully vaccinated. And fully vaccinated takes 2 injections. One injection is not working well at all with the Delta variant. Takes 2. And that's why this 2-month time frame for it to work. What was the other part of the question now?
The folks who have immunity through having had the virus, are they included in that percentage at all?
No. The thing is that natural immunity to the COVID vaccine, especially to the Delta variant, is not good. And that's true of a lot of viruses. Sometimes the natural illness gives you better protection, and sometimes the vaccinations give you much better protection. With Delta variant COVID-19, then the vaccine gives you much better long-lasting protection.
And that's evidenced by reinfection. I mean, we've seen quite a few reinfections of people that have been previously positive and then reinfected within a time frame.
Yeah, and no vaccine is perfect. The vaccination for COVID-19, I mean, it's up in the 95 percentile as far as preventing, especially bad disease, people being in the hospital and dying of type disease. So it's a problem.
And one of the questions that you had was the numbers. That's Morris County. And that
Yeah,
data
that's
is
right.
collected. Anybody, any entity, whether it's a pharmacy or a health department or doctor's office, they're required to report to the state of Kansas any vaccinations that they give, and those go into a database. And then the numbers are generated from that. So it's based on, even if you go to another county to get vaccinated, it still counts as a Morris County vaccine. So it's Morris County altogether.
And all those numbers available on KDH. You can go and look up by county, all those statistics.
Yes.
So.
And then you alluded to this just a little bit, but there was a question regarding data for getting the vaccine to change the rates. So the example that was listed was vaccinated people are able to get the virus. Is this information available? Is there somewhere that it's being documented, the rate of people that are getting the virus after having been vaccinated versus people that are getting the Delta variant that haven't been vaccinated?
Yeah, and I think we get a lot of our information from the CDC recommendation, so that information is there.
KDHE is working on that data for the breakthrough cases that should be, once they get that put together, then they'll have that on their Facebook page and website as well.
And I have been studying this for years. I've been studying hours a day for the last year and a half. And there has never in the world been a better vaccine, a safer vaccine than what we have right now. I'll challenge anybody who says it differently. It has been the most studied vaccine, 4 billion doses, billion with a B, doses in the world. And it's studied intensively all the time. That's why they can come up with these complications of vaccine that are 1 out of 2 million. You wouldn't know that on most vaccines because you don't have that intensive study.
And then our final question, Dr. Freese, relates directly back to the mandate and our operational guidelines and where we are at this time right now. So per the mandate as it is set forward, at what point in the day are students not required to wear masks per the mandate as set forward? So the conversation that we were having was, it looks like lunch is the time when they're eating that they can remove that. Recess, excluding the time when they're lined up, because that would include the masking because of the social distancing. And PE, is that when participating in the physical activities part of that?
Well, I think, as far as sports, I think that when people actually participate in the sports, that's the time they can take the mask off. Mostly it's outdoors versus indoors, because outdoors you have much better ventilation. You have probably better spacing of the children from each other. But I think even if you had a PE class or something, or recess inside a gymnasium, I think that's an open enough space that when they're actually physically active, they would not require a mask. You agree with that one?
Because they can socially distance.
Yeah. Yeah. So it's basically, if you're indoors next to each other, you need to have a mask on.
Dr. Freese and Kendra, thank you. Those are the questions that we've had for you today, and we really appreciate you answering those for us.
Terry, I want to make sure we clarify something here from a school board perspective. The word vaccine's been used a lot, and there's a big misnomer out there that we will vaccinate kids in school against parents' will. And that is simply not true. I want to make sure everybody listening at home, and it's on record, knows that anything we do in the school system requires a parental or guardian consent. So without your signed consent, we will never do anything to your child against your will. So I know there was a Facebook post going around that's saying the inaccurate statement that when you send your kid to school for attendance, that's consent. And that is not true. So it just makes sure everybody knows there's a term called imprimis locus, meaning in replacement of the parent, that our teachers and educators follow. That means we're going to act in the best interest of your child for the safety, health, and well-being, just like you would as a parent. So we will never do anything to your child without your written consent. So I want to make sure that's clear, because I want to make sure people know their kids are safe when they come to school. There's never going to be an opportunity where the term stabbing day has been used and those types of things, where we would vaccinate your kid against your will. That will not happen, period. I promise you that.
Here's a question about that. Is that a good masking? We have to have parental attention for childhood mask.
No.
Childhood mask.
Okay, so moving forward to the guidelines, and we've got a document here that once the mandate is over, where we feel today, we feel that we can start to move toward, and this is open for conversation, and this is a draft. This is a fluid document. Again, I don't think I can emphasize enough that this would be, once the mandate is over, we do intend to follow the mandate regardless of what this document says. This is for after that.
Can I clarify
Yeah.
something?
Yep.
Intention might not be the right word, just because that signifies that there's a choice there.
Right,
And I want the public to understand that this is not a choice we have at
Right.
this point.
Thank
So
you.
if you could maybe restate that we are following the law,
right.
because that's what we have.
Yeah, we will be following the law and the mandate. So, yeah, sorry, and thank you for that
That's okay.
clarification.
I have one other clarification. Can we please explain the home rule and how that applies to our school that is located in another county?
Yes, you want me to do that?
Please.
So obviously, we have 4 counties in our school district that make up our geographical boundaries. 2 of those counties have attendance centers in them. Obviously, one being here in Morris County, the other one being in Wabunsee County. And so those are 2 different health officers, right? 2 different county commissioners that govern 2 different counties. The school district has the authority to implement what's called home rule, meaning that they can set the standard for our other attendance center in another county based on what our home county is doing. And so since we are following and then currently under a mask mandate, and that's the law here in Morris County, we will follow that same mandate for our children and staff in the attendance center at Wabunsee County in Prairie Heights at Alta Vista. So, and the reason for that is a long list, but mainly to keep it consistent, because we have multiple families that have kids in both attendance centers. And when they drive down the road and come into Morris County and go into our buildings here in Morris County, they are under the law for a mask mandate. So if they have younger siblings in Wabunsee County going to Prairie Heights and older siblings here, it gets very convoluted, it gets very difficult and inconsistent to follow. It makes Dana's life very miserable as a health officer for our school district. It makes Wabunsee's health officer and our health officer's life very miserable, answering questions back and forth between multiple counties and multiple standards. So our board is elected to do home rule, which means the Morris County rule will affect both attendance centers in both counties.
Thank
Does
you.
that make sense? Okay.
All right, so Mr. Doty, we've got the document up here in front of us. I'll let you
All right.
lead that charge.
So this, I want to make sure, look at the last sentence in the text box at the top. That's starred. It says current county, state, or federal mandates supersede operational guidelines set forth in this document. So this document is in effect. If the mask mandate expires, we revert to this, right? Parameters such as the quarantine things that affect us while we're under the mandate will be followed. So this document is what we will adopt, and I want to stress the term fluidness to this, because what we adopt tonight, as we've experienced over the last 17 months, we may have to meet tomorrow and adopt something different. And then 12 hours later, again, repeat, sunrise, sunset, repeat, right? So this is a starting point. I want to make sure that's very clear to everyone. This is a starting point, and it may change as the situation changes throughout the year. So let's kind of walk through this. I don't know what you're talking about. All right, yes, we'll get that first. Thank you. So mask, students recommended and encouraged, but optional for students. Staff in grades 7 through 12, it's recommended and encouraged, but optional for staff. And in pre-K through 6 in our elementary buildings, it's recommended and encouraged, but optional for vaccinated staff. And unvaccinated staff members will be required to wear a mask when working within 6 feet of a student. The goal there is keeping kids in school. We don't want quarantines. So if we do have a positive amongst an unmasked, unvaccinated staff person, that we do not have to quarantine a classroom full of kids or a handful of kids for that. Contact tracing and quarantines. Contact tracing will be done in cooperation with the Morris County Health Department. That's no different than we did last year. Positive cases will isolate according to the Morris County Health Officer. Quarantining will not be required when deemed a close contact if there is consistent and appropriate mask wearing by the positive individual and the close contact. So again, that's one that can change based on guidance that the health officer and the health department receive from KDHE and CDC. But as of right now, that's the position we're in. Quarantine options, if considered a close contact due to COVID-19 exposure, are as follows. If you've been previously diagnosed within the past 6 months, you stay in school. If you have a positive test from a COVID-19 test or a physician diagnosis that you can produce, then you can stay in school. If you're vaccinated, you stay in school. You do have to require verification of your vaccination. If symptoms do develop while you're vaccinated and in school, it will require quarantining or additional parameters set forth by the health department underneath those guidelines. If you're not vaccinated, option one will be stay in school if a parent or guardian, again, stress, if a parent or guardian consents to having or opt in to having their student tested on a daily basis with a non-invasive COVID-19 negative test, which we are working right now with the state to get these machines. They're Abbott machines. They are, what do you call it, the metabolic test, molecular test, thank you, not an antigen test. The health department has them, so right now we'll be sending, we're working with them to get them tested, but hopefully very soon we'll have them on site in each building where we can do it ourselves. And again, this is stressed. This is a choice that we're offering for parents to help them stay in school and not have to take off from work, to quarantine at home. If they stay symptom-free and you consent for a test every day, a non-invasive, it's not the brain scan that you go up and go all the way up to high nasal pharyngeal. Now it's the non-invasive swab, and it's negative and you're symptom-free, you can stay in school. Because our logic behind that is working with parents to provide choices that just make sense instead of them going home and waiting 14 to see what days, to see what if happens. Let's keep them in school, add multiple layers of protection so we can make sure they're staying negative and keeping themselves and others safe, but still having them in school, still having our staff in school working and teaching with kids, and monitor that very closely. So again, this is an attempt to work with parents and work with staff members to keep our doors open and keep kids in school. And then if you do not want to consent to the test or have your child consented to the test, then you have the option to quarantine at home. Okay, just like we did last year. I do want to stress though, and we'll talk about this at our back to school convocation, the Family First Coronavirus Relief Act has expired. So there is no more additional sick leave provided for staff or parents and other entities that work in other employment areas for time to go home if they're quarantined. So I think that's important to staff members to know as they're making decisions on their own personal choices on what they choose to do, that if they do choose to quarantine at home or they have to quarantine at home because they have symptoms, there is no additional sick leave granted based on the federal guidelines now. Now that could get reinstated, but as of right now, the Family First Coronavirus Relief Act has expired.
I just have a question.
Yeah.
Since Dr. Freeman can't join me, after some things we discussed today, I wondered if it would be appropriate under that option one to change our daily non-invasive COVID-19 testing to say periodic non-invasive COVID-19 testing. And I know this wasn't we should have talked about it before, but
That's all right.
I thought that might be, it just hit me with that. If you guys agree to it as well, that was something we kind of discussed a little bit today, and the word periodic came up. I didn't know if that was something that we could maybe adjust that word. What are your thoughts on that?
CDC have a guideline.
KDHE said daily.
They said daily.
Okay.
Because I thought I saw some recognition of blue, 1 or 3 or something like that.
I don't think there's some new testing guidelines for vaccinated individuals.
That's
But if they're unvaccinated and you're trying to keep them in the school, the regulations.
Very good. That's a perfect example of that fluidness that I think we're going to see throughout this.
Terry, would you be able to summarize what was just talked about? It's all mumbly and I can't hear anything.
Sure. Dana asked the question if we could change the daily testing to periodic, and it was clarified that the periodic is for vaccinated people who might be experiencing a breakthrough, but the daily is still the recommendation for unvaccinated people on those tests by KDHE.
But it does sound like there'd be some potential changes. If you're vaccinated, maybe it's not every day, it's day 1, 3 or something like that at some point. So potential changes there based on situation. All right, diagnostic screening and testing. We'll still use our thermal imaging cameras to continue to be used to monitor temperatures of students, staff, and visitors in the building. We have them, might as well leave them there. And then COVID-19 testing will be available in each school health office with parental and guardian consent. Again, if the parent consents, if they have symptoms and they would like for us to test them, we will test them. Additional screening and testing options may be available in cooperation with the Morris County Health Department upon guardian or parent consent, opt in. So that's just one of those catch-all statements. As things change, new technology comes out, new systems comes out, new recommendations comes out, we will continue to work with the health department and KDHE to make sure we're staying on top of it. Hygiene measures, we'll still wash hands. Hand sanitizer available in the classrooms and throughout the facility. Social distancing when possible. Stay at home when feeling ill. We'll have signage in the buildings and in the facilities, setting expectations and reminders of the hygiene and the necessary measures for preventative aspects. Cleaning of facilities. We'll still have our cleaning regimens and protocols that we established in our navigating change document will continue this year. Cleaning solutions that are rated will be used that are rated to eliminate COVID-19. So we'll stay on top of that, and as new and more as chemicals that come out that are not invasive and harmful, but yet are more effective, thank you, will be adopted and used. So we'll continue to stay on top of that and stay up on the latest availability for the cleaning solutions. And all classrooms will have supplies as they did last year to clean desks, doorknobs, handles, supplies, and so forth. Vaccinations to school communities. Vaccine opportunities will be available through guardians in cooperation with the Morris County Health Department. Vaccinations will not be required to be in school, and any vaccination requires a signed consent from a guardian of each student. Okay. Accommodations for children with disabilities. Students with an IEP, a 504 plan, or other documented supports will have all the appropriate accommodations and supports made available to them. Coordination with the state and local officials. We will meet regularly with officials on the latest data to inform stakeholders as needed, and we will consider all state and local health guidance. And then the continuity of service, academic needs will be met through continued full-time in-person instruction. And that is a law now as well that we have to be in person. Remote learning is no longer an option. And that is a state law passed by the legislature. Summer learning opportunities were offered, and we'll continue to expand on those as we move forward into next summer. Virtual learning opportunities are available. Virtual is different than remote. That's an important concept to know. Social, emotional, and mental health needs will be met through our social emotional curriculum, our counselors, and our social workers. And then student health and food service needs will be available to all students. All students will have access to free breakfast and free lunches daily this year, as well as our school nursing services will be available to them.
The only other point of correction I have is you capitalize social and emotional. So if you're going to do that, you need to capitalize the M in mental health, or you need to allocate the E in emotional.
Yes. Okay.
So what are our next steps with this document?
So what we'll do now is, once the board approves this draft tonight, or disapproves, whichever happens, I would like to send this out to our stakeholders. So it'll go out in a survey to parents, it'll go out to survey for teachers, it'll go out to survey to students to seek their input on, so we can gather input from them. They'll have an opportunity to comment, make suggestions, give any ideas or thoughts they may have that may be more beneficial or more or less detrimental in their opinions. And then I'll accumulate that data, I'll bring it back, and that'll be all part of our ongoing discussion. If we need to change things using the data that we receive from the health department, from KDHE, CDC, and we also have our patron and stakeholder data that we can add, use as part of that in determining the decision.
And as we disseminate this information, we want to make sure that everybody knows that we're going to follow the law and the mandate. I don't know how many times we can repeat that tonight, but that's what we're going to do. So this document, whatever happens in the next few minutes, as far as it getting passed or not passed, really won't come into play until the mandate is over. We are going to follow the mandate. Can I say that one more time?
We follow the law.
Yeah.
Period.
So, board members, comments, questions about the operational guidelines draft?
I do have a question, and it actually came from a stakeholder today. It's more of a comment, but could you address the legalities of offering a vaccine at school? I know we can, but can you just
Absolutely.
address that, why and how we can do that so parents understand that we can do that?
Right, so part of the plan that KDHE has put out to school districts and to the State Board of Education is a vaccination plan that works in conjunction with the health department to allow access to students and families in multiple fashions. So like the health department's done mobile clinics where they've set up tents and things that allow drive-through clinics to allow easy access. The hospital has a drive-through vaccination. At one point they did, I don't know if they still do, but it's multiple areas and avenues to allow those who choose and want to be vaccinated to become vaccinated. And so offering a vaccination clinic in the school is just another avenue for parents not to have to take off work. If they sign a consent and they're in favor of their student being vaccinated, they can sign that consent, send it in, and then they don't have to take off work. They don't have to take their student to a doctor's office or the health department or to the hospital to get that done. So it's just another vehicle to offer opportunities for those who want to do it. Now, there is no publication of that. There is no shaming of that. There's no bullying of that in the school system. And someone might say, well, everybody knows that you got to leave class to go do it. Why don't you? And I had a parent ask me, why couldn't they just walk down to the health department and do it? Well, I guess the counter argument there is if they're worried about their leaving class to go on the day they know vaccines are being offered, they're obviously going to know that student walks down to the health department and get it too. So no matter what you do, somehow there's going to be some risk of kids knowing what's going on. So, but we follow the HIPAA rules. We do not violate Student Privacy Act. If that student chooses to do it, that parent signs a consent and chooses to allow their student to become vaccinated, that's just another avenue for convenience for a parent.
Thank you.
And I might just add to that, we do our best to, maintain that confidentiality, even though it is in the public school setting. So we don't do it out in the gym or in the hallway. We're always in the nurse's office in the back room. So.
Well, you might share, how many visits did you have to your office last year? It was over 15,000, wasn't it?
Total for the district,
Yeah.
right? I don't know,
Right.
yes, it was.
So that's 15,000 is a pretty accurate number. So Dana sees over 15,000 kids a year in her office for various reasons, right? So I don't think, it's not a concern amongst those parents and kids that when they have to go in there for whatever reason they're going in, no one knows. And that is confidentiality. So there's a lot of traffic coming in and out of that office.
And we have also, this isn't anything new. We have held vaccine clinics for all the years I've been in school health. This is my 16th or 17th year now. We have done vaccine clinics every year.
I think the biggest concern that parents have is just the uncertainty of not knowing if the student will be forced to vaccinate. And that's why I say we can promise you your child will not be vaccinated without a consent.
Absolutely not.
Just like it wouldn't be for the flu vaccine that we give or anything else that's done in school where we used to do the dental cleanings and so forth and hygiene checks and give fluoride and those types of things.
We can't even give like simple Tylenol or ibuprofen without a parent consent. No medication. can we do without a parent.
That's a good point. I don't know if those listening online can hear that, but Dana just mentioned we can't even give a Tylenol or an Advil without a parent consent.
Cough drop.
Cough
Yes.
drop,
Yeah.
yeah,
Thank you for the clarification.
good question.
Other comments or questions about the operational guidelines document? We need a motion to approve. Oh, was somebody online to have a question?
I think my question, I think my question is, not exactly related to the operations guidelines, but more a logistical question. So I can save it or I could ask it now, whatever.
Go ahead.
I thought I remembered seeing an email, but I can't find it. And so I just want to clarify. Under the mandate where the kids and the staff are wearing masks, if a kid tests positive, let's say, and they are still both masked, then do the kids in the close contact have to quarantine, or is that not a thing now because they're wearing a mask? I couldn't remember which way we went with that. And I just wanted some clarification on that.
So as of right now, the way our operational guideline states, if there is a positive case and both the individual that's positive has a mask and the individual that's in close contact are appropriately wearing masks, then there is not, that individual that's in close contact does not have to quarantine as long as they're symptom free.
Bullet point number 3 under contact tracing and quarantine.
But I think Adam's question is, what about right now during the mandate? Is that right, Adam?
Yeah,
So,
that's
like-
correct. I read the operations guidelines, but that also did include, that masks were optional. So I just wanted, that's why I said I wasn't sure if my question fell in.
But no, and I think the copy you received, Adam, didn't have that bullet point on there, because this was just added in correspondence with Dan and Dr. Freeze, that piece. So yeah, the operation guideline that was sent to you in the board packet did not have that bullet point on there. That's why I made these copies for you tonight, so.
Okay, thank you.
Well, and Dr. Freeze, correct me if I'm wrong, but the actual mask mandate does not contain anything in the wording in regards to quarantine, correct?
That is correct. It's a separate issue.
Okay.
Can
Right,
I'll
so-
repeat that, Adam. The question was, does the mandate currently talk about quarantine, but that's a separate subject. So the mask mandate and quarantine are two separate things.
It's actually two separate statutes, too. So statute like 126 through 129 is about public health quarantining, and then the statute like 124 is about these types of mandates. So there's different legislative statutes addressing those two different things.
Right.
And to answer your question, Adam, yes, technically we should have 0 quarantines right now, unless someone's symptomatic. And that becomes an isolation, then probably, most likely. So as long as everybody's masked up, we should have very minimal quarantines if we're following the protocol correctly.
Thank you.
Good. Others? So we need to make a motion here.
I'm
Yeah,
sorry.
go ahead.
Just since you said that, I just wanted to clarify that there will be times that that the kids are not masked,
Right.
which we talked about.
Right.
Lunchroom, sports, PE, so we would hope that, we try to keep that 6-foot distance so that there's not that quarantine, but that is that possibility.
Sure.
And also I want to make sure it's known too, because I have received several letters from parents about medical exemptions for their students to not wear a mask during school, which that's perfectly fine. We'll honor that, but they are subjected to the quarantining guidelines and if they're not wearing a mask for a medical exemption in school. And we will honor those exemptions without a doubt, but they are subjected to quarantine.
Are the elementary school kids gonna be social distancing in every, in the classrooms and everywhere?
At our last, in June, at our meeting there, what we decided, or the board decided, is to leave that up to each building principal, because each dynamic, the class space, the class sizes are different in every building. So each building principal is going to the best of their ability to maintain a balance of keeping kids as far apart as possible, but yet maintaining as normal as environment as we can for our MTSS intervention groups, our small group work that we do for reading and phonics and math, our different intervention groups and so forth. So not everybody will be social distance. Now, with that being said, those rooms that can't because of size, they're working in cohort groups. So meaning that if there might be a group of 4 kids that sit together, but those 4 kids will stay together. They will sit together at lunch. They will try to stay in that cohort group. So if one does become positive, they're not contact tracing multiple other students. It will only be those 3 kids in that pod or 4 kids in that pod, whatever it may be. So it'll be back to basically what it was early onset before we went to clearing out every single piece of furniture in the building and having teachers stand the whole time with no desk and having 0 intervention groups and 0 small group reading tables and so forth. That's what we were doing before we did that, was keeping kids in cohort groups the best that we can. And it'll look different. At Prairie Heights, it's going to look different than at Council Grove, just based on size. Classroom sizes are different at the high school and junior high. So they may have less kids in the class, but it's a tiny class versus an elementary classroom. They have 30 kids in it and a larger class, and vice versa.
I just wanted to make sure that we were clear on that was still the way we said it in June, because Dr. Freeze just got done talking about how we needed to keep the students apart. And that's not part of his mandate, and it's part of our operations guidelines. And I know one of the biggest concerns from our admin staff in June was how social distancing was basically, it was very damaging, especially to the young kids.
Well, I think part of the thing that Dr. Freeze has worked very well with us on during this is trying to find a balance of keeping kids in school, but trying to maintain an educational environment that, to the best of our ability, is conducive. And obviously, you can't have one or the other completely, but trying to find that balance where we can still try to do. We want to mitigate learning loss. That's the biggest thing. How can we keep kids in school with minimal learning loss and still function as safe as possible?
And I would like to add to that, that the admin team, when we met, didn't use that word damaging. And so I want to be careful when we're putting words out into the public. It was more stated that they're ready to get back to the kind of learning and teaching and practices that we know are effective and efficient. And so I think we need to be careful when saying damaging, because I don't want to put words in their mouth.
Yes, thank you.
Yeah, I'm not trying to put any words in anybody's mouth. I'm not as eloquent at speaking as everybody else in the room, so I apologize for that.
All right, so anybody else have a comment or question? Well, so in a moment, we're going to get a motion for the operational guidelines that will take effect at the end of the mandate, because as stated previously, we're going to follow the mandate. So yes, I would take a motion on this item.
One thing,
Okay,
the mandate is only about face coverings in Morris County. So the rest of this operational guideline information all starts today, correct? Okay.
Unless something changes that would affect a piece of that. This is our governing document, but any mandate will supersede this.
Right.
So right now, the only mandate superseding this is the mask portion.
right. That's a great clarification. Thank you.
And I would just like to state that a lot of us have taken personal attacks regarding us following the law and our guidelines. We took an oath as elected officials to uphold the law, and we intend to do that. That is why we took that oath. Teachers take oaths, medical professionals take oaths, elected officials take oaths. So I would just like to remind everyone that we took an oath to uphold the law that was set in front of us, and that is our intention. So with that, Mr. President, I move that, given the 2 typos that we correct, that we approve the operational guidelines as presented for the 2021-2022 school year.
Been moved and seconded that we approve the operational guidelines as presented with the corrections for school year 21-22. Further discussion on this item.
I'd just like to ask for a new editor person. This went to the whole admin team and the Dana. No one caught those typos. They're all in trouble. Help me out there.
Actually, I was the typer too.
Yeah, so let that reflect. I did not make a typo this time. Thanks, Al.
All in favor, raise your right hand. All opposed? So passed. Thank you, everyone, and thank you guys for coming and providing your knowledge. We do appreciate it.
Thank you.
Thank you so much.
Our next action item, moving right along, is the 2020 or 2021-2022 budget review, hearing date and publication.
I have a question. There's 2 different times listed. Is that because we're covering one of those pieces?
Correct.
Okay.
Well, yeah, so Tina Ray's question was, if you'll notice on the hearing form, let me get to it here. So we have to set by law now. So let's back up a little bit. Remember, let me refresh your memory when we talked about Revenue neutral rate is a new term to all of us. It's new to our county clerk. It's new to everybody. So what happened was in the Senate, actually in the House, I believe it was the House, this bill was introduced to help counties remove the tax lid because some legislation was passed a while back, years back, that actually put a tax lid on counties. And what counties were facing was budgetary problems across the state, raising enough revenue, tax money to fund their budget because of this new law that restricted some things. So this law was intended to reverse it. Well, at the 12th hour, I believe it was the House that added schools to this bill. There is absolutely no point for schools to be in this bill because we are already governed by statutory compliance. For instance, 20 mills has to be levied by statute to send to the state of Kansas for the general fund budget. So every school district in Kansas levies 20 mills that goes to the State Department, and then they redistribute those funds out based on your FTE, your full-time equivalent. So that's a law we have to follow. By law, we can only levy up to 8 mills in capital outlay. That's already a law. We can't go above that. And by law, we can only levy up to 33% of our general fund budget in our LOB budget or local option budget. So those are already laws protecting our citizens from us going crazy and raising taxes through the roof. Everything else, like bond and interest, they have to vote on and approve. So, but it is what it is. It passed. We are now under this government. So how this will work is that every year by June 20th, we have to let our county clerk know what our revenue neutral rate is. So she sends us a form that looks like this. She calculates what our revenue neutral rate is. And how they do that is they take your total taxes levied and divide it and come up with your revenue neutral rate. And you have to either stay within that revenue neutral rate or hold a hearing to go above it. So you already passed a resolution at our last board meeting to go above it. So you'll see here the irony, and it's kind of humorous, is that the revenue neutral rate is only 19.288 mils for the state of Kansas in general fund for us. We have to levy 20. So every school district in the state is going to be not be able to meet the revenue neutral rate unless the only way you will be able to stay within that is if your community unfortunately is dying and your property valuations are decreasing. Okay, so if that's the case, you're actually going to go up. You're going to be higher than 20 mils. Right? So it's an unfortunate thing, but it is what it is. So this is what we get from Chelsea by June 20th, but we have to let her know by June 20th if we're going to exceed this or not. This year, it didn't go out in publication, but in the following years now, then our county clerk will have to send out a letter to every single patron in Morris County, letting them know what our plan is as a Board of Education and every other taxing entity's plan is if they're going to exceed the revenue neutral rate. That will get published and sent out to every single patron, which we have to pay for as a school board. So we don't know what that will cost yet, but it will be expensive because Chelsea, the resources they will put forth to do that, plus the postage and so forth, it will be expensive, probably upwards of $10,000 to $15,000, real rough estimate. So money well spent on that, but we will do that. And then, so we have to hold a hearing first to decide we're going to go above and hear patrons' concerns if we're going above the revenue neutral rate. And once that hearing concludes, then we can go right into our regular budget hearing. So by law, you have to have 2 hearings, but you can hold them right together with each other. So we don't have to hold them on separate dates. So that's why you see 2 different times. One's at 5:40 and the other one's at 5:45 before our regular board meeting next month. If that works for everybody, that's what we're suggesting here. Now, we did learn, there's a lot of confusion in the state about this, because at first we were told we didn't have to set the hearing date yet when we turned our document into the county clerk, which said what we were going to levy, which is this piece over here that we tell them we're going to levy. But we did have to set a revenue neutral or a hearing date when we turn that in. We were told up until the 12th hour we didn't by the state, and then we did. So that's why I just went ahead and showed our next board meeting date. Hopefully that works for everybody. Because we didn't have time to get a consensus to set it at that point by the time we found out what we had to do. And that wasn't the clerk's fault, county clerk's fault. That was just the way this whole process has been a very difficult process to unpack as we move through it. And that was the state thing. All right, so in a nutshell, here's our code 99. So this shows you what we are proposing for our budget this year. And again, I want to remind everybody that this is truly not a budget. All this is, by law, is we have to publish this to get authority to spend tax dollars. So if you'll notice in here, our expenditures are pretty large compared to what they were in the past. Because if we do not publish these expenditures for the authority to spend them, we cannot do it. So think about it like this. If we have $1 million sitting in capital outlay and we don't publish authority to spend $1 million of capital outlay, and our roofs blow off in a storm and we need to get them fixed while we're working with insurance, and you've got $1 million sitting there and you don't publish authority to do it, you can't touch the money. So that's why we always zero everything out and publish for the authority to spend it all, but we don't spend it all. We financially budget then after September 20th is when we get our count date, and that's when true budgeting happens. Right now, we're just working on pure estimates based on our trends from our enrollment in the past, based on our trends for our risk numbers, our free and reduced meal prices, our transportation numbers, all those are just estimates. Enrollment happened. We have a better idea now, but it's still not the case until we actually get audited by the state on count day for September 20th. That's when true budgeting happens. This is just authority to spend money. So I can do however you guys would like. We can go through all the codes. All right, this is kind of a summary of the codes and however you'd like to do it, but kind of the open page, if you go back, we've done this in the past, just as a reminder, this is where we just plug in our data. And then it goes on to Form 110 is where we actually talk about tax and process, and we plug in what our taxation rate is. This is where it kind of gets into the weeds, but if you don't set a high enough tax collection rate, we operate on a fiscal year, taxes are collected on a calendar year. So there is a 6-month window that taxes in process are being collected on a previous budget. So it makes it very difficult to set mills when you have a tax in process rate. So that's why you see September and October are different than January through June, because this is our fiscal year. We're going to levy the money as quickly as we can and get the budget, the bulk of it here, so we make sure enough taxes are being collected to fund our budget. If this column's lower and this column's higher, and you have delinquent taxes, you have situations where maybe the mill rate didn't come out to be where it should have been based on assessments, because evaluations change constantly throughout the year. We may not collect enough taxes to fund our budget. So that's why you see this being so disproportional here. It all totals 100% in the end, but we're collecting 90% of our taxes on these 3 months. The others are over here, and that's just simply due to tax and process. Go on to the next code here real quick. Form 150 is basically where we set our general fund budget. So this is where we estimate what our FTE count is, our full-time equivalent student count, or head count. We want to know how many at-risk kids we're going to serve. We get half-time funding for those. Again, these are all approximations. These all have to be done before our enrollment happens, so we don't even get that window of time to get a more accurate count. We're just basing this on estimates and trends. That's why we spend a lot of time collecting data and looking at trends for what is our enrollment doing, what is our at-risk numbers doing, what is our pre-K numbers doing, looking and talking about what's going on in our community so we can make these accurate predictions as possible. We don't have a lot of fluctuation and change. And all this stuff gets calculated, all of our weighting factors get calculated. This is where you see our estimated operating budget for 21-22 will be $7,480,000. And then we get a levy 33% of that for our general fund budget, which is a different code. And then basically that all gets, so here's our local option budget. Here's where we'll set 33%. That's going to generate another $2,447,000. So we have about a $10 million budget for our school district based on our local option budget and our general fund budget. And then the rest of all these codes, these are, I can't see. So like, for instance, we go to code 08. This is going to be our supplemental general funds. So this is where we go in, and these are just placeholder values. So this is where we actually go in and budget the different line items. For instance, salaries, benefits, and we pay salaries out of title funds, we pay salaries out of at-risk funds, we pay salaries out of our general fund, we pay salaries out of our supplemental general fund. And we actually pay some maintenance salaries out of our capital outlay fund. So salaries get divided under lots of different windows. By law, we have to pay certain salaries out of certain funds based on how they're being used. So for instance, at risk, we have to pay a certain number of salaries based on evidence-based practices for at risk. Title is a different story as well. So These are just placeholders. We go through and we budget different line items. So this is really kind of irrelevant. This is placeholders for the money. But the bottom line here is when you get down to the end of this, this number down here has to add up to what we can levy. So if we don't levy the full amount, we don't have the authority to spend it. That's the key right there. So you'll notice these always balance out. So right here, we have a zero balance. Our expenditures add up, our taxes collected for all of our motor vehicle recreation tax add up, our supplemental state aid. All these categories line up. And Micah goes in and uses APTA fund to plug in our actual expenditures from the previous years because those change based on where we're at in the budget, based on what our actual expenditures are. And then that helps calculate these columns for our actual expenditures versus our budget. So you'll see we have budgeted $1,049,240 of revenue from taxes. Someone might say, well, wait a minute, but I thought our local option budget was 2.5 million approximately. The difference there is we already have a cash balance in our supplemental general fund. So what that happens is if we collect more, in this case, it was a refund from the county, which we'll get to this in a second, but if we collect more taxes, let's say we predict we're only going to collect 96% in taxes because of the other 4% maybe through neighborhood revitalization plan, delinquent taxes, or changes in evaluation assessments. So we may end up generating more funds, but we don't get to spend those dollars. So let's say we generate $3 million for some reason in our LOB. That doesn't mean our budget goes up, woo-hoo. That just means those extra dollars carry forward as a tax credit for the following year. So instead of levying $2.4 million, we'd only levy whatever the difference is between the cash carryover balance and what our authority is. So we don't spend more than we could have authority to spend. It just stays as a tax credit for the future, the next year for our patrons. So you can see our tax rate here. This is where we figure our mill rate is going to take to generate those funds. It's going to take 15.116 mils. That's what you'll see on code 99. Then that gets transferred over to code 99. And that's what you'll see right there, that 15.6116 mil rate. And that's what we do for every code. We do that same process for our general fund. We do that same process for capital outlay. We do that same process for at risk and all of our different weighting categories. And in the end, that's where you come up with your total mill rate being levied, which would be 58.63 mils. Exciting stuff. It is to me. Yeah.
Can you talk a little bit about how we would be affected should we need to write a check back to the county to city lease holders for this?
Yep. So we're going to dive into the whole pending lawsuit next. So any questions over this before we move on? Okay, so one of the things that happened, remember we talked about the tax lid, the ceiling on the counties? So one of the agreements that you entered into and Mr. Conwell entered into with the county was that they would hold the taxes that were being questioned by the lawsuit between the City Lake Association and the county. And so that lawsuit has been going on since, and my numbers aren't going to be exact here, so don't quote me on these, but I think since 2012, I believe. Yeah. So 2012 and 13 have been settled, done, paid, refunded, back and forth, whatever happened back then. But 14 and 15 got appealed, and now I think 16 through 18 is in appeal. So the county's been holding our funds every year because the problem is if the Lake Association wins the lawsuit, then those taxes have to be refunded. But we've already spent that money. It's gone. We paid our bond debted services for that. We paid salaries for that. That money's gone. If we have to pay back several $1 million plus to the Lake Association patrons for taxes owed back to them if they win the lawsuit, we will not have the ability to do that readily. So we will have to work with the State Department to come up with a plan to allow us to repay that over a multiple year scenario, because otherwise our tax rate is going to go through the roof. I mean, to collect, because our bond indebtedness, our bond collectors aren't going to say, hey, we'll give you a 3-year break. Sorry, don't pay us. They're going to say, no, we want our money. So our mill rate for our bond is going to go from about 15.5 mils, probably upwards of 30 to 35 mils on top of what we already collect. Just because we got to generate enough funds. So if we have to pay back several $1 million out of cash reserves in our bond, we have to generate those funds to pay our bill. So it's a big deal. This needs to get settled one way or the other. We need to figure out what's going on because we are in limbo as a school district trying to figure out how to balance our budget, not knowing what the future holds. So that being said, that's why when the county's tax lid got hit, they had to refund a couple of years ago. If you remember, I came to the board and said we were going to get a substantial refund back from, or it's not a refund, that's a poor choice of words. We're going to get the money they were holding for us in case they lost the lawsuit and had to repay it. So it didn't impact our budget. They could no longer do that because they had such high cash balances because of them holding those tax dollars. They couldn't generate their own funds to fund their budget with. So they had to refund them to us. They didn't have a choice. So that made our cash balances go up that year. And then this year as well, we had this was the final year of repayment of those funds they were holding for us. So that's why we received those, and that's why our mill rate went down in LOB considerably, because we already had a huge cash reserve. We didn't have the authority to spend because it was held from previous years. So this is the, if none of that makes sense, here's the most important thing to remember for this. When the county holds money, or we have to withhold money to pay back, that's not just, for instance, let's say the county held $1 million in LOB funds. We lose that authority to spend that money that year. So that's $1 million hit. If the county wins the lawsuit and they pay that money back, which they gave it back to us now, that's not $1 million extra dollars we get to spend. That becomes $1 million tax credit towards the next year's taxes. So not only did we lose $1 million that budget year that was held, we lose an additional $1 million in authority that following year. So 1 million turned to 2 million. Then let's say the county loses and we got to repay that $1 million to the Lake Association patrons. Now 1 million became $3 million because we lost $1 million in the budget authority and revenue the first year. We lost $1 million in budget authority the second year, and then we lose $1 million to repay them the third year. Does that make sense? That's why this is a compounding issue that's extremely difficult to predict. And then that's the same thing in our bond and interest funds, or same thing in our capital outlay funds. Now, here's the other big kicker. We get state aid, we get state equity aid in our LOB funds, our bond and interest funds, and our capital outlay funds. So meaning that in bond and interest and LOB, the state pays a portion of that based on your poverty rate, your evaluation per pupil. We are in the midst of, I think we get, I can look it up on here, but 15 or 16% state aid in one fund, we get around that in the other fund. Well, if you don't receive those taxes, you'll lose that state aid. So it's a double hit there too. So not only, and what state aid, equity aid means is that the state realizes that a county that has a higher cost per pupil rate or evaluation per pupil, assessment per pupil rate, like for instance, Johnson County can go levy 1 mill and generate millions of dollars because they have a huge assessed valuation, right? Someplace like Galena, Kansas, who only has an assessment of much smaller, may only generate $14,000 with 1 mill. So in order to provide kids with equal access and opportunity to education, the state legislature said we will subsidize or pay equity aid to a district that doesn't have to go in and say, hey, in Galena, if they want to do something, they're going to have to tax their patrons a much higher rate than Johnson County. So it closes the inequity gap there and tries to make it more equitable amongst counties with high valuations and low valuations. But we fall in the middle there, and that's why we get some state aid, and we lose that too. So there's that balancing act of making sure we're capitalizing on getting as much state aid as we can, so we don't have to pass those expenses on to our local patrons. Because if we lose state aid, that means taxes go up, because our local patrons are paying more of the cost. As long as we can keep our state aid, then our taxes stay lower because other people in the state are paying taxes in that are coming here. That make sense? Yeah. All right. What else? What else am I missing here?
I think it's important for us to keep in mind or to know, if people don't already know, that the Kansas State Board of Tax Appeals has already sided with the City Lake Association for 2012, 2013, and 2014. And what they cited on is the taxation process, which has not changed since 2012. Between 2012 and 2021, the taxation process is the same. That's why we keep going back to the Kansas State Board of Tax Appeals every year. Until that process changes, we're going to stay in this position. And if the Kansas State Board of Tax Appeals continues to side with city like leaseholders and not with Morris County, we're going to need to continue to repay this money. And it's going to keep impacting us negatively because we're talking about so many years in the past. This is a huge debt. And I'm a little concerned that we're going to get to a point, like, let's say next summer, ODA decides we're going to combine these cases. We're going to side with the City Light Association from 2015 to 2021. It's a huge problem on our hands. We cannot pay that bill. So I think, I don't know what we can do as a community to have more conversations about how this is affecting us all, about how this is affecting taxpayers, about how this is affecting the school district and the city. But we need to find a way to get away from this, especially because at the state level, the way the tax lid has changed, we cannot hold on to those funds anymore to repay those debts. So I don't know what we need to do, who we need to get in a room with, what needs to happen, but our patrons are really going to suffer should we be saddled with this enormous debt.
And so those are the conversations I have or did have with Dale Dennis on a regular basis, and now with Craig, who's replaced Dale. And their advice to us, because we're in a rock and a hard place, because we can't, that's why Doug had the county keep them, because we can't keep them here because we don't have a way, a mechanism to store those funds without increasing cash balances. We could transfer funds to contingency reserve, but then that's a double-edged sword because then the state legislature looks at it and goes, oh my gosh, look how rich you are. We need to cut your funds. So that's a double-edged sword there. And so that's why Doug had, Mr. Conwell had the county keep them, to keep it out of our books so it didn't convolute our state reporting issue. And we don't have the authority to withhold LOB funds like that because that's the authority to spend them by statute on what we have to spend them on. If we keep a cash balance there, it doesn't do us any good. It just gets applied as a tax credit, as I explained earlier. So we're in a rock and a hard spot on that school district. Yeah. But yeah, no, it needs to get resolved. It's important that this gets resolved.
All right, other comments, questions about the budget review? So going back, you're proposing that we do the hearing date on the 13th. Actually, we review it one more time and do a hearing date on the 13th of September.
Right, so
at the next board meeting.
you approve, tonight's process is you approve the budget for publication, which means we send it into the Republican and they put that code 99 form in the paper with our hearing. 5:40, we'll have the hearing for the revenue neutral rate. And then at 5:45, we'll have the budget hearing as we normally do every year. And then you'll approve the budget. That's when you actually approve the budget at September 13th. And that's when we then send it to the county clerk so she can start collecting taxes on it. That process has changed greatly on timeline wise from what you're used to. It used to be we had to have it to the county clerk August 25th. And now with the revenue neutral rate changing, there was no way we could get the budget done in time to get revenue neutral rates set. We didn't even have our funds standard. We didn't have those funds reconciled from the state yet. Back then, we usually get our last state aid payment in July. So it's very difficult. You're backtracking on closing out your expenditures once you receive your final state aid payment. So that's why I really drove the kinks of things, but we made it and we'll make the best of it. And we'll get better at it as time goes on as a system.
Mr. President, I move we approve the budget hearing date and to publish the 2021-2022 budget as presented.
Moved and seconded that we set the date of September 13th. And we publicize the budget as presented. Is that fair? Discussion on that item. All in favor, raise your right hand. All opposed?
And just for clarity, in case someone asks you, we did not raise the mill rates. We made sure and kept, we actually, I think went, yeah, we did go up, I apologize, to 0.2 of a mil. And that was because of the revenue neutral rate, honestly. We did have it set completely, but then due to the tax and process issue we had to raise our LOB, no, I'm sorry, it was our at-risk numbers increased for budgetary purposes which raised our revenue in our LOB funds. So it took it up, those 2/10. And instead of going back and changing all those numbers, we just said we're gonna leave it as is.
Okay. Our next item is an executive session for personnel. How long do you think we need for that?
Start with 10 minutes, so we don't have to keep multiple motions. And if we get done early, we can take a drink of water.
Mr. President, I move we go into an executive session to discuss an individual employee's performance pursuant to non-elected personnel exemption under COMA with Mr. Doty and the board for 10 minutes.
And there'll be no action. So Marcus, if you want, feel free to leave. We'll put you in the waiting room, come back. And we will not restart the live stream just because there'll be no action. We'll come out of executive session adjourn. If for some reason there needs to be action, which I don't know what that would be, we'll start the stream back up.
Okay. All right, moved and seconded that we have a 10-minute executive session. All those in favor, raise your right hand. All opposed. Thanks, everybody, for coming.
Thank you.
You're welcome.